Okay, today we're going to talk about the Affordable Care Act. And before I talk about all of the details of the Affordable Care Act and what it does, I think it's important to highlight what the current problems are and how badly our current system sucks in comparison to the rest of the world, because it's not that good. And I think it's important to outline the problem before we say what our quote-unquote solutions are to that problem with the Affordable Care Act. And yeah, let's go ahead and get started. I'm hoping that me sucking will be far outweighed by how badly our healthcare system sucks, so that I don't get the spotlight shown on me for how bad everything is. All right. So let's start with healthcare costs, which are currently rising at twice the current rate of inflation, as this wonderful thing in blue can tell you. Our gross domestic product is basically everything that we accumulate in a year. That's everything that we create as a nation in the year. And right now, healthcare costs are 17%. Some say a little bit higher than that of our GDP. In the UK or in Japan, for instance, it's closer to 8%. So we spend double what they spend on healthcare coverage, and we actually don't get the results that they do. Japan is #1 in life expectancy in the world, and we are somewhere around, well, our infant mortality rate is somewhere around 70th place, and our life expectancy overall, once you get over 65, I think it's 20th or 25th place in the world. So in other words, we pay almost double what most industrialized nations pay, and we aren't getting a whole hell of a lot for it. The costs have risen 3 times faster than our wages have risen. And if you don't get health insurance from your employer, which was how health insurance actually got started, your costs are going to be 3 times the average amount that person would pay. So somebody that works for GE pays 1/3 in their healthcare costs that you pay. If you have an individual plan, if you even have insurance. So let's go ahead and talk about our second issue here, which is that 50 million people are uninsured. That is including people who are young, people who are between policies right now, who have had a lapse in their coverage. But the important thing to note is that is 1 in 6 Americans that are without health insurance right now. That's 50 million. That is 50 million shades of fucked, Miss Steele, and not in the good way. The family of 4, by the way, in case you're wondering how we're paying for these people, because it's not like these 50 million people who are uninsured don't go to the hospital. Because they do, they just go to the hospital when the shit has hit the fan and there is absolutely no way in which they can go to work the next day having the pain that they have. And so the way that we're paying for these people when they wind up in the emergency room is everybody who has insurance already is already paying for them. Let me say that again. If you have insurance, you're already paying for people who are uninsured. If you have a family of 4, on average are spending $900 to $1,200 extra in premiums every year to cover the cost of people who are going to the hospital when they break their leg or have a heart attack and they don't have insurance. You're footing the bill for them already. So it's important that these people get health insurance so that they can actually be the ones that are covering their own costs, #1. But it's important to note that part of the reason why these people don't have insurance isn't because they don't want insurance, because if people had the option to have it, they would get it. It's most of the time the reason that they can't get health insurance is due to this. They can't afford health insurance because of the rising costs of the insurance. And so more and more people are becoming uninsured, and it's getting to a point where the uninsured are getting paid for by the insured, and those uninsured people are dying by the truckloads and going bankrupt by the truckloads. the 50 million people who are uninsured aren't helped by the fact that insurance is a business. And what I mean by that is that there's nothing wrong with that. Insurance started in this country based off of, in World War II, there were a lot of companies competing, and one of the ways in which they were able to compete for workers was they would offer health insurance programs for their workers because they didn't have the money at the time to actually pay their workers. So they offered these extravagant medical health programs and things like that to pay for the workers, to entice them to come work for them. And that's kind of how health insurance got started in our country. In other countries, it got started, again, after World War II, when their people looked around at the crazy devastation that had happened in Europe and said, holy fuck, we really just tore ourselves a new asshole here, and we really should make medical health a priority for people, because we have a lot of people coming back from war who have, missing limbs. We had the bombings over, the Dresden bombings. We had all sorts of, crazy shit that happened throughout history. Anyway, enough about Europe. Insurance is a business. You can't fault them for wanting to make a profit, because that's their job. A company doesn't owe anyone anything. They only owe their shareholders, and their main prerogative is to make money. It's not exactly customer service. A company only offers customer service in the extent to which it gets customers to come back to them so that they can make more money. So if they can exclude a certain amount of people and save money, they will do that. And that's okay. That's what businesses are for. But the problem with that is that because insurance is a business, it's kind of grown out of control as a business. For insurance as a whole, 23% of the costs that you put into your premiums go towards administrative costs right now, and that means overhead. People who are writing policies, people who are doing stuff, the bonus pay for CEOs, things like that, that's what it's all going towards. Now, if you look at private insurance companies that are handled by the government in other countries, such as Japan, you're looking at more around 8 to 10 to 12% administrative costs. And right now we're running at 23. So again, it's double the cost, and we're not getting a whole hell of a lot for it. The other problems that we have with insurance being a business is that 4 to 5% of the claims that people put in for insurance are just flat out denied. And most of the time, those claims are from people who have real problems with them. They have leukemia, they have cancer, something along those lines. These aren't for people that are, going to the doctor to get a checkup or something like that. But once they reach a catastrophic illness, insurance companies actually have people whose job it is to go through that person's medical history, to go through that person's medical records, and to try and find a way to not pay them out. So they're trying to find a way basically around paying for these people's medical bills, because that's their goal as a company. Because their goal as a company is to make money, it's not to help people. These insurance companies will only help their customers as much as they have to. There are cases where there was a woman who who went in for a mammogram. She found out that she had breast cancer, and she had her bills paid for by Blue Cross Blue Shield. And then it turned out that there was a yeast infection that she didn't disclose. And her health insurance was dropped, not just from that moment, but retroactively for the previous year and a half of treatment that she had gotten. So she had to wind up paying somewhere around $140,000 worth of medical bills, which is, of course, basically it's not a death sentence on your life, because, we will pay, or we will take care of you in hospitals. but it is a death sentence in the way of your life will never be the same again because of your illness. Let's go ahead and talk about, the other problem with insurance companies is that they can ban you based off of pre-existing conditions. Pre-existing condition can literally be anything. When I was looking up what exactly qualifies as a pre-existing condition, I found out that not only were yeast infections included in that, but ear infections, basically anything and everything that you would potentially not disclose on the medical form. And that actually happens quite a bit because while people are filling out their insurance forms, much like I did, I had an ear infection 2 years ago, and I did not disclose the fact that I had an ear infection on there. Now I'm concerned that because I didn't include that ear infection on there, that at any particular time, if I were to get cancer or have a catastrophic illness in the future, my insurance company could drop me like a bad habit if they so desired. And that's particularly why our healthcare coverage sucks right now. They can take back the money that they already paid out. They can go through your history and make sure that there's a reason to drop you. And keep in mind, there are people whose sole job it is to go through and find these things in your medical history. So these people are paid bonuses based on how much money they save the company. In order to fix that, we have to change some things around. Excuse me. This comes at a 2-drink minimum, I assure you, talking about this healthcare topic. I realize that due to editing, it's going to appear as though I have just teleported off of the screen. I should really tell my insurance company about this pre-existing condition of teleporting. But I wanted to share with you all really quickly something that's important, which is, excuse the shaky cam, going independent movie on you here. Each one of these tick marks represents someone who has gone bankrupt because of medical bills. Each one of those green X's represents someone who has died because they were unable to have health insurance. It's important to note that half the bankruptcies in the United States happen because of healthcare costs related, and that 75% of those people that went bankrupt actually already had insurance. The amount of people who died and went bankrupt in UK, Japan, Taiwan, 0. In the United States, it's a much different story. Remember, these aren't numbers, these are people.